Good afternoon and welcome everyone. We're going to give it a couple more minutes before we get started to allow people to finish joining. Just doing sort of a sound check and making sure you all can hear. Throughout the webinar, if there are questions, you can put the questions in our Q&A box. And if we have time, we'll try to answer them live, or we'll take them back and we'll provide responses after the presentation today. So we will get started in just a few minutes. All right. It is 1 o'clock. It looks like we still have people joining. Excited to be here with you all today. We have a couple things that we want to share with the group. One, you may have received some information regarding our National Core Indicator surveys. Pam Sund, I believe, is with us, or Marilee, our colleagues from Quality. We're excited to have them here with us to present today. Want to go over a few things with you all about that. And then we're really excited to share information regarding critical incidents. You guys hear from us often that we have to assure the health and safety of the people that we support. One of the ways that we do that is through our critical incident process. We have to tell the Centers for Medicaid and Medicare as part of our waiver applications how we define that, what we define as critical incidents, how we track that, how we report that, and why it's, and we wanted to take today to sort of share that. So I'm really excited. We have Marilee Andrews from our quality team, who has done a lot of work in this area. So after we talk about the National Core Indicators, she's going to jump into a presentation around that. So thank you, Marilee and Pam, for joining us today. And with that, Marilee, I'm going to go ahead and turn it over.
Hi, good afternoon, everybody. Like Christy said, my name is Marilee Andrews. I work here at OCDD. My colleague, my boss, Pam Sund, I believe is on the way to talk about the National Core Indicators surveys, abbreviated NCI. So before she does that, I just want to make sure as she's presenting and I'm presenting, I see that there's a hand up. Were there any questions or like some housekeeping to get out of the way before we start?
Thank you, Marilee. This is Christy again. So we do not, in these webinar sort of settings, we don't typically do question and answer live. There's just a lot of people on and a lot of information to cover. So we are asking that you put your comments, your questions in the Q&A. And if we have time at the end of Marilee's presentation or in between Marilee and Pam talking about the National Core Indicators, we will answer those questions. If we're not able to get to them, we'll coordinate internally to collect all those questions and provide responses.
Okay.
Marilee, does that works, Marilee?
Oh yeah, that's good with me. That's totally fine. Pam's here and she's gonna talk to you guys about NCI.
Good morning. As y'all know, we are participating in the National Core Indicator Survey process this year. And we are working with a company called Clarent. And Clarent has been contacting families about participating in 2 surveys. One is the Child Family Survey. Now that survey was mailed out to families. And so right now we have 225 families that have mail that survey back into Clarent, and we need at least 400 families to participate in that survey. So if you received it in the mail and you have it just lying around, we're asking that you please complete that survey and mail it back in the self-addressed envelope to Clarent before June 30th, and that will really help us a lot. Also, we have the adult in-person survey, and that's for adults 18 and older. And Clarent has pulled a random sample, and they are contacting families and asking families if they want to participate in the survey. So we're pretty close to meeting our target for that, but just want to let y'all know you still could be contacted by Clarent to participate in those surveys. And if you did not get a survey, you can contact, for the in-person, you can contact Jessica Justman, and I have her information there. And if you got the Child Family Survey and you don't remember where you put it, you can contact Ebenezer and he can make sure you get another copy of the survey. So if you have any questions or concerns, you can contact me. It's pam.son@la.gov. But we would appreciate very much if you would help us to kind of meet our target. So the survey asks questions about self-determination, service coordination, access, relationships, community inclusion, rights, choice, decision-making, health and safety. And so we ask these questions so we can see how we're doing as a state with hopes of making some changes and improvements to our service delivery based on the feedback that we receive from the families. So very much appreciate if you can help us. Thanks.
All right, thank you, Pam. And I see we have Brenton Andrus, who's with the DD Council, and I believe the DD Council pushed out some information on NCI as well. So if you get their alerts, it'll be in your email there, and I'm pretty sure they still post them online, so you could read more about it there. So I'm gonna shift gears. I'm gonna stop sharing the NCI document, and we're gonna shift over to critical incident reporting. All right, I'm hoping everybody can see my screen. Just let me know if you can with a little something in the Q&A. That's always really helpful for me when I do these types of presentations.
Hey, Marilee, it's Kim. It looks a little bit small to me.
Okay, let me work on it. Is this better?
Oh, yeah, much better.
Too
Thank you.
much or good?
You can go down just a little bit if you need to, but that's pretty good. Yeah.
All right, good deal. Okay, so as I mentioned, I work at OCDD. I work in the quality enhancement section. And so a lot of what we do in the QE section is we monitor critical incidents that happen to our home and community-based waiver participants. And I have a slide deck prepared for you guys. I worked really closely with the waiver sections. That's Christy and Kim and Janae and the people on the call here. And I'm going to open it up from our website. So I'll just show you that web address right here at the top. So this is where you can access this slide deck. It has a lot of information. And if we go down here under resources, this is the presentation we're going to talk about today. It's made specifically for the self-direction population. So just wanted to show you guys that. It's very easily accessible by everyone. Something you can print, you can save it on your desktop, you can keep it in your home binder. That's something that you have at home. And I'll just go ahead and jump right in, and I'm sure we'll have time for questions at the end. So we're going to talk about critical incident reporting for the self-direction population. If you do have any questions, please, as Christy mentioned, put them in the Q&A, and I feel confident we'll have time to go through those at the end. Or if you would prefer, you can email me directly. My email is marilee.andrews@la.gov. And this here is just a reference to what I've just showed you guys. This is OCDD's critical incident reporting page. So this is hyperlinked here. A lot of things, if they're underlined in blue like this, you can go ahead and open it straight from this slide deck and it'll take you to that place. And this is right where we started. A little agenda so everybody knows what to expect. I'm going to just give a brief history with regards to critical incident reporting for OCDD. We're going to talk about waiver participants and those rights and responsibilities that we agree to when we accept a waiver. We're going to talk about, of course, critical incidents for waiver participants, a little bit about what I call the OIF5. That's this bullet right here. So OI is operational instruction, and that's like a kind of a policy piece at OCDD. And the OIF5 is all about critical incident reporting, roles and responsibilities of different people in the critical incident life cycle. There's a critical incident flows through a number of groups of people, and there is a role and responsibility along the way with that. I wanted to talk briefly. This is a suggestion from the waiver section. I thought it was really smart about why critical incident reporting matters. I know you have a waiver. There's a lot of responsibilities, and I think it's helpful to talk about why we have to do what we do here. So I'm going to touch on that a bit. Then I'm going to dive deeper into what are critical incidents. And this information that's going to be covered in this bullet is pretty heavy. So I'll go slow and I'll take questions at the end. And then we'll finish up with how to report abuse, neglect, exploitation, or extortion, how to file a complaint with OCDD. And we're going to talk about the resources, which we've already talked about this webpage here. That's going to be one of the resources we talk about at the end. And then lastly, I put in acronyms. It is overwhelming, I think, just the number of acronyms that are thrown out, especially if you're new to the DD system. And so that was something I certainly learned when I entered the DD system. And so I wanted to include that for you guys at the end. The Office for Citizens with Developmental Disabilities, OCDD, is where I work and where Christy works and the other OCDD people on this call. And we are one piece of the whole Department of Health. OCDD serves as the single point of entry. Sometimes people will call that a SPO, into the DD system, the Developmental Disability System. OCDD oversees services for people with developmental disabilities who are in our state. And importantly, and what this group is OCDD administers waivers, home and community-based service waivers, HCBS waivers, for people who have disabilities in Louisiana. OCDD has 4 waivers, and those are listed right here for you. So these are the 4 OCDD HCBS waivers. And you guys are the self-direction group, and the supports waiver is not not an option for self-direction, as I understand it. So it's the now, the row, or the children's choice for self-direction. Whenever you accept a waiver for someone to become an OCDD participant, you sign a rights and responsibilities form. So in exchange for this waiver that you're receiving, which is federally funded, you have some responsibilities as well as rights. And I've hyperlinked it here. Again, this is a hyperlink, so you can open this and you can revisit that form. I know when you are getting a waiver, kind of that onboarding process, there is a ton of paperwork. So this is hyperlinked here for you if you would want to go back and look at it again, if you happen to have misplaced it or you don't have it in your home binder. But these are essentially your rights and your responsibilities as someone receiving HCBS waiver services. And I just wanted to put this little excerpt here. It is an agreement. And so when you accept waiver services and you sign it, you're saying that you understand your responsibility to cooperate. And waiver services may be discontinued if you do not fulfill your rights and responsibilities. There's a lot on this document. And again, you can look at it here. I just pulled out a few specific to this presentation. Some of your rights: dignity and respect, person-centered planning, privacy, freedom from coercion, restraint, and seclusion, a choice, freedom of choice in the service and support providers when there's a choice available. And then some of the responsibilities: participating in planning and decision-making, cooperating with OCDD, so that's myself and the waiver section, your LGE, your local governing entity. So there's 10 for OCDD across the state, regions 1 through 10. So like if you're in the Baton Rouge area, your LGE is Capital Area Human Services District. Your support coordinator, someone who's going to contact you monthly and visit with you about how the participant is doing. You have a responsibility to report medical visits, emergency room visits, hospitalizations to your support coordinator as soon as possible, but within 24 hours. And to understand the definition of a critical incident and the requirement for reporting critical incidents to your support coordinator. Critical incidents for OCDD waiver participants are incredibly important because part of what OCDD must do, the state of Louisiana must do in exchange for federal funding that we receive to pay for waiver services, is we have to assure participant health and safety. And so that is one of our responsibilities, ensuring safety, quality, and accountability. Sometimes in life, as we all know, something happens, an incident or an action that impacts the health, safety, or well-being of a waiver participant. And it can be minor or major. And again, I'm going to go through the definitions very specifically. And these are called critical incidents. They must be reported to the participant's support coordinator. So your role there is reporting it to your support coordinator. And the support coordinator will kind of do the legwork of getting that incident entered and communicated with the LGE and everyone at OCDD. Critical incidents are defined in that OI F5, that operational instruction F5, which I mentioned earlier on the agenda. It's hyperlinked here. I think it's about 9 pages. No, a little longer, 12 pages. The last page is blank. So this is it's called the OIF5, like I mentioned, which stands for Operational Instruction Number F5. And it's all about critical incident reporting here at OCDD. Its full title is Critical Incident Reporting, Tracking, and Follow-up Activities for Waiver Services. So Critical incidents, which we're talking about here, they're defined in this operational instruction. It starts right here on the first page. And all of this information in this OI is what, regarding the types of critical incidents, is what we're going to go over in this presentation. So the OIF5 is really a document, like I mentioned earlier, with instructions basically on how to operate regarding critical incidents for waiver participants. So a person who is receiving linked and certified HCBS waivers from LDH, specifically OCDD, is what we call a participant. It applies to reporting critical incidents, tracking them, and following up the follow-up activities for critical incidents, again, which are defined in this OIF5. And this is to assure the health and safety of these participants. The biggest job for you guys in the self-direction population is the reporting. Other parties in this process will do a lot of the legwork. You just have to make sure you report it. There are different roles and responsibilities in critical incident reporting, like I mentioned earlier, which are again outlined in this OIF5. It's hyperlinked here. That's again this document. It applies to OCDD waiver participants and their families, the self-direction population, so participants who choose to self-direct or families of participants who choose to self-direct. Direct service provider agencies and direct service providers. So this does not apply to you all. But again, I'm just telling you what the entire OIF5 encompasses. Support coordination agencies and support coordinators. Your LGEs, those local governing entities that we mentioned, those are regions 1 through 10. OCDD's central office quality section. So that's where I work. I work in the quality section with Pam Sund, who spoke earlier about NCI surveys. And a critical incident, the responsibilities kind of culminate at this last group here called the Critical Incident Review Committee. So all of these groups have roles and responsibilities. And today we're just going to talk about these top two that are in bold. This presentation is just covering those two. It's just for y'all's population. So starting with OCDD waiver participants and their families must keep a copy of this OIF5 and paper copies of the CIR form at their home location. So at your home location, this should be printed, and I call it a home binder. A lot of people have a home binder. This would go in that home binder. Families, waiver participants and their families should understand the types of reportable incidents called incident categories. This is just a longer way of saying understand what are critical incidents, what that list is, and the requirement for reporting them timely to your support coordinator. This third bullet is very important. Understanding that all visits to an emergency room, an urgent care center, or an acute care facility is reportable. You must tell your support coordinator if the OCDD waiver participant goes to one of these three places. Even if you're not sure which category it would apply to, because remember there's incident categories, no matter what the category is, if there is a visit to one of these three places, families absolutely have to tell their support coordinator. OCDD waiver participants and their families must report critical incidents as soon as possible, no later than 24 hours after the incident occurred, and provide as much information about that incident as possible. So if you went to a hospital, what was the name of the hospital? the emergency room or the urgent care center? Were there any discharge orders? Was there a medication change? If a participant was arrested, are there court dates? Or perhaps the participant is currently incarcerated. If there were any reports to CPS, APS, or EPS, including those. So CPS is Child Protective Services, APS is Adult Protective Services, and EPS is Elderly Protective Services. So these are kind of the three agencies that investigate abuse, neglect, exploitation, or extortion. And they're broken out based on age group. So CPS is for children, APS is for adults, and EPS is for the elderly. And I will go over specifically with you guys what age is broken up into what category. And OCDD waiver participants and their families should participate in all planning meetings. The goal is to resolve any critical incident that has occurred. Some resolutions are very simple, some may be more complicated. And you want to develop strategies to prevent or mitigate similar critical incidents from occurring in the future. And this is kind of a theme you'll see if you read the OIF5 or you look at other people's roles. All the groups are working together to essentially prevent or mitigate similar critical incidents from occurring in the future. So now more specifically to the self-direction population, and some of these things are going to be repeated from this slide for waiver participants. So this is going to cover just the self-direction population, which is, of course, is made up of waiver participants. So there you will see all of that information again. So again, keep a copy of the OIF5 and paper copies of the CIR form at your home location, in your home binder. Understand the types of critical incidents that we are required to report them timely to your SC. Understand that all visits to these three places are reportable. I'm going to define them here. Report any visits to these three places to your support coordinator and your fiscal employer agent. I think you guys say FEA in the self-direction group. I just say fiscal agent, same thing. There are two fiscal agents if you are self-directing Acumen and Morning Sun. So whichever one is yours, as well as any discharges from these facilities. The SC will do kind of the legwork, reporting it as a critical incident here at OCDD and with the LGE. Your main job is to just report it to your SC and they will do the legwork from there. So a quick little talk on these three places. An emergency room is really an emergency room or an urgent care center. So we all know what those are. An acute care facility has a bit of a longer definition. The short version is it's a hospital. Any hospital is an acute care facility according to this definition, which is in OCDD's OIF5. So if you or your family member who is a participant go to an emergency room, an urgent care center, or a hospital, you must tell your support coordinator about that visit. Report critical incidents as soon as possible, no later than 24 hours after the incident occurred, to your support coordinator. And again, the support coordinator will kind of do the legwork of entering that critical incident with us here at central office and with the LGE. They enter it into something called SIMS. I thought that this was out of the slide deck, but if you see the word SIMS, what they're doing is they're just entering the critical incident that occurred into an online secure database where the LGE and myself here at central office, we look at that critical incident. You must provide information about the critical incident, which we talked about on the slide about family responsibilities. Discharge summary or orders, names of hospitals, medication changes, things like that. Participate in all planning meetings with, again, the goal is to prevent or mitigate the likelihood of similar critical incidents from occurring in the future. And because you are self-directing for yourself or your family member, you have the responsibility to train your employees on all of these roles and responsibilities that we've talked about. So just like you need to understand what's a critical incident, understand that ER, urgent care, and acute care visits are reportable, all these things that you have to understand, your employee, your staff that you've hired has to understand that as well. And that is kind of an extra step for someone who's self-directing that you have to take on. So the critical incident process is just kind of an overview, kind of wrapping up what we've talked about in terms of roles and responsibilities in critical incident reporting. It begins with the waiver participant when that incident occurs. It goes through a whole group of people all the way to OCDD central office. That's where I am. Along the way, every group that we talked about has a part to play in looking at the incident, assuring participant health and safety, completing proper follow-up. So after the self-direction, I'm calling it provider, the self-direction provider, so that's you guys, report your critical incident to your support coordinator. The support coordinator has work to do, the LGE has work to do. Here at central office, we have work to do. And then the critical incident review committee, that's this last bullet here, will look at critical incidents that cross a certain threshold. So if a participant has had a large number of falls in a certain period of time, that will bump it up to the critical incident review committee. We talked in detail about family responsibilities and the self-direction population responsibilities. We did not talk in detail about these responsibilities. If you are interested in that, there is another presentation on critical incident reporting for OCDD and the operational instruction F5. And that's available on OCDD's critical incident page, which we talked about earlier. This is the link to it. You can peruse this website. You'll see a lot of what we've talked about. The critical incident categories, which we will talk about. But you can go down and under user resources, there are all of these resources. And that slide deck should be here. I believe someone's updating the website right now, but that slide deck will be here under training materials. This is a great link, so I would bookmark that if you can. And remember, that's where this slide deck that we're looking at right now is also here on this page. So shifting gears to why critical incident reporting matters. And I touched on this briefly. So the federal government, specifically CMS, provides Louisiana with funding, with money, federal dollars, for the state of Louisiana to administer waiver services. And OCDD administers those waivers like we talked about earlier. In exchange for that money that the federal government is giving Louisiana, they want to know that we are protecting people from harm, that we are assuring participant health and safety. They're checking us to make sure we're doing our due diligence with that federal funding that they've given us. And the way that they monitor this is through strict reporting. OCDD, where I work, we report critical incident data on a quarterly basis and an annual basis. And then even sometimes in between, like with ad hoc requests. So we tell CMS how many of each type of critical incident, how many in a waiver, things like that. If critical incidents are not reported, what happens is Louisiana risks losing its federal funding to pay for these waiver services. And CMS has ways to which they monitor and they check things like that. And we have to provide them with a lot of information that they review. So if they find that critical incidents are not being reported, that's a problem for us as a state in terms of providing waiver services. Continued access to waiver services for you if you are self-directing, or your loved one if you're a family member self-directing. Reporting helps us to ensure that. And families and participants are the most important. It starts with you guys, and you guys do play a vital role. You guys do the reporting. If you don't tell us, if you don't tell your support coordinator, we won't know. Additionally, and I just wanted to add in this last bullet, just to kind of give a bigger picture, we here at OCDD, we look at larger patterns or risks, you could say, that are affecting on kind of a macro scale. And it gives us the opportunity to improve that. So if we have, all of the majority of our participants are falling, that would be something we would look at specifically. So we take that as an opportunity to improve the service delivery system with the data that we have on critical incidents. I'm going to jump into types of reportable incidents. So these are incident categories. This next section that we're about to go through has the heaviest material. And so I'll try to give it to you guys as simply as possible, but there are some nuances in there, and we can talk about that at the end. But essentially, if any of these things happen to a waiver participant, that's considered a critical incident. I'm mentioning it again here in this bottom blue rectangle. Anything at all that happens to which a participant goes to an acute care facility, an emergency room, or an urgent care center qualifies as a critical incident and must be reported. So what that means is, let's say you took your child, or you, if you're self-directing, went to an emergency room, and you don't really know if it falls into any of these categories. That's okay. Just tell your SC, hey, we went to the emergency room, or we went to a walk-in clinic, and your SC will determine how to find the correct category. And we're just going to go through each of these one by one, and that's what we're starting on right now. Abuse, neglect, and exploitation. Abuse are acts defined for child abuse or adult elderly abuse that seriously endanger the health and safety of the individual. Neglect is failure by a caregiver or other parties to provide necessary care for the person's well-being. Exploitation is illegally or improperly using or managing funds, assets, or property, power of attorney, or guardianship for their own profit or advantage. This right here, RS, this stands for revised statute. So if you see RS after a definition, that means this came from state law. So Louisiana state law is telling us this is the definition for exploitation. I mentioned earlier when we were talking about information to include when you report a critical incident to your support coordinator. I mentioned if there is a report or anything that has to do with CPS, APS, or EPS, you must include that information as well. And so this is a little bit of a deeper dive in there. Abuse, neglect, exploitation, or extortion. For someone who's aged 0 to 17, that age group is considered a child, and you would report that to CPS, Child Protective Services. That's your group if you have a participant aged 0 to 17. What you would do is you would immediately report the abuse, neglect, exploitation, or extortion to CPS and your SC. Remember, we have to always tell the support coordinator. If the abuse, neglect, exploitation, or extortion involves a participant who's between the ages of 18 and 59, that means we're talking about APS, Adult Protective Services. Your role would be to immediately report it to APS and your support coordinator. If there is suspected abuse, neglect, exploitation, or extortion of someone who's 60 or older, that means we're talking about the elderly population, and we'll be dealing with EPS, Elderly Protective Services. You would immediately report that to EPS and your support coordinator. The definition for child abuse is infliction or attempted infliction, or because of inadequate supervision, infliction occurred of physical or mental injury to a child by anyone. It's also the exploitation or overwork of a child, or the involvement of a child in any sexual act with anyone, or aiding or tolerating in the child's sexual involvement. This includes pornographic displays or any other involvement of a child in sexual activity. When I say anyone, that can be primary, is if the accused is the biological mother, father, the stepmother, the stepfather, or the legal guardian or curator. That would be primary. It's kind of a subcategory. Non-primary child abuse is if the perpetrator is essentially anyone else. Now we have a little bit different definition for abuse for adult and elderly. That is the infliction of physical or mental injury by other parties, and this can include but not be limited to sexual abuse, abandonment, isolation, exploitation, extortion of funds, or something else of value. So much so that the well-being of the adult or elderly person is endangered. And we have a little bit of a definition for extortion, which is essentially acquiring something of value from an unwilling or reluctant adult by physical force, intimidation, or abuse of authority. So now we'll talk about neglect for a child. Refusal or failure of a parent or caretaker to provide the child with necessary food, clothing, shelter, care, treatment, or counseling, or an injury, illness, or condition of the child that results in the child's health and safety being substantially threatened or impaired. We have the same explanation over here on this right blue square for primary and non-primary. Primary is if the accused or the perpetrator is the biological mom or dad, the stepmom, stepdad, or the legal guardian and curator. And again, non-primary is essentially anyone else. There is a caveat here for child neglect that I need to go over with you guys. When instead of being provided medical care, a child is provided another treatment in accordance with the tenets of their well-recognized religious method, that is not considered to be neglect or abuse. Neglect of the adult and the elderly is failure by a caregiver responsible for that adult's care or other parties to provide the proper or necessary support, medical, surgical, or other care necessary for the person's well-being. Same caveat here. If an adult is being provided treatment in accordance with their religious method instead of medical treatment, that is not considered to be neglect or abuse. We also have a kind of a sub-definition for self-neglect. Neglect can also be self-neglect, which is failing to provide the proper or necessary supports or other care for your own well-being. Same caveat. If the adult is being provided treatment in accordance with their religious method instead of medical treatment, that is not considered self-neglect. Exploitation is the illegal or improper use or management of funds, assets, property, power of attorney, or guardianship for your own profit. And so from here on out, the definitions will not differ between child, adult, and elderly. And I just wanted to point that out. Death is straightforward. Death is determined by a coroner or a physician who issues the death certificate. All deaths are reportable. It doesn't matter why or where the person died, or if they were on hospice. All deaths are reportable critical incidents. A fall is the next incident category we're going to talk about. So the participant is found on the floor or ground and in an unwitnessed event. And this does not include someone who is intentionally on the floor, or the person comes to rest on the floor or the ground unintentionally. This would be something that you witnessed, that you saw. And this does not include people who are falling in the course of an activity, like playing sports. Involvement with law enforcement is when a participant or their staff, so that could be their staff as well, or others responsible for their care, are involved with in an alleged criminal manner, either directly or indirectly. So much so that law enforcement became involved. So a participant is arrested, or law enforcement is called due to the actions of the participant. A staff person is arrested. A staff person receives a traffic ticket, a citation for a moving violation while transporting the participant. Loss or destruction of home is damage to or loss of the participant's home that causes harm or risk of harm to the participant. And so this can be a broad category. Man-made reasons or natural reasons, wind damage, fire, flood, unsafe or unhealthy living environments, major behavioral incident. It's kind of a broad term. So I'm going to break it down. It's not so straightforward like death. A major behavioral incident is an incident engaged in by the participant who is alleged, suspected, or witnessed by the reporter that can reasonably be expected to result in harm, or that may affect the safety and well-being of the participant. So some examples: suicidal threats. So the person, you've seen them heard them make suicidal threats. Missing person, self-injury, non-consensual sexual behavior, or physically aggressive behavior. Another note right here, just remember, any incident where the participant goes to an emergency room, an urgent care center, or an acute care facility qualifies as a reportable incident. Major illness. Any substantial change in health status, and this part here is very important, suspected or confirmed, that requires medical treatment at one of the following locations. And these are the three places: emergency room, urgent care, or acute care center. So you thought there was a health status change, so much so that you went to an urgent care clinic. But let's say you get there and turns out you tested negative for the flu or COVID or whatever you went for. That still qualifies as major illness because it was suspected. So much so that you went to one of these three places. Now remember, anything that happens where you go to one of these three places is a critical incident. It is specifically a major illness if it's a substantial change in health status. And then we have some specific major illnesses that should be reported out by category. Those are bowel obstruction, decubitus, pneumonia, and seizures. These should always be reported. Major injury is any suspected or confirmed wound or injury to a participant where they ended up going to one of these three places: an emergency room, an urgent care center, or an acute care facility. So wound or injury, and you went to one of these three places, is major injury. Substantial change in health status, and you went to one of these three places, is major illness. A major medication incident is medication being administered incorrectly. It can be not as prescribed, to the wrong person, failing to administer the medication that requires the participant to go to one of these three locations. So that can be, and again, the three locations are emergency room, urgent care, or acute care. It can be staff error, pharmacy error, person error, medication non-adherence, or family error. Restraint use is there are three types of restraints: personal, mechanical, or chemical. So application of one of these three restraints for the purpose of restricting or suppressing an individual's movement or preventing that person from accessing their own body. A personal restraint is physically restraining someone. A mechanical restraint is mechanically restraining someone. And a chemical restraint is with medication. Any procedures expressly prohibited by OCDD policy or CMS should be reported to the appropriate investigative authority under the abuse category. Some actions are confused with restraint but are not restraint. So use of orthopedic appliances, essentially how they're supposed to be used, approved techniques such as physical guidance, escorts involving a brief hold in which there is no resistance observed, transport, so physically moving an individual from one place to another where there's no resistance, and typical activities that are momentary in nature that anyone would do naturally in a moment of imminent risk, such as blocking someone from entering a street if there's a vehicle coming. These are not restraint. A little bit about healthcare admissions that result in a critical incident. And I know that I'm repeating myself, and I hope you guys can bear with me. The reason for that is that we're finding that visits to emergency rooms, urgent care, and acute care facilities are being underreported. So this slide is just about that. Any incident or action, anything that results in the participant going to an ER, an urgent care center, or a hospital. Remember, an acute care facility is a hospital, qualifies as a critical incident and must be reported. They are not separate categories, but they are covered under one of the categories we've just talked about. So if we hop up here These are our incident categories. We've just talked about every single one of these. You can go read more about them in the OIF 5, which everyone should have printed a home copy. But they are listed for you here. They're listed on OCDD's critical incident reporting page here. And they're defined in this slide deck. So a visit to an ER, an urgent care center, or a hospital is not on this list. But any action that results in a visit to one of these 3 places must be reported, and your support coordinator will help to determine which category it goes under. We have just a few slides left. And it looks like we have plenty of time. I think this ends at 3. So I'm going to go through these next few slides, and then we can open it up for questions. The Department of Health has a policy on abuse and neglect. The Department of Health is committed to preserving the right of each person who is receiving services to be free from abuse and neglect. So if you're receiving a waiver, you are receiving services. LDH prohibits all forms of abuse and neglect, and LDH requires each program office to establish an abuse and neglect policy specific for that office. So I mentioned OCDD is a program office, and this OIF 5 is OCDD's abuse and neglect document. It covers abuse and neglect and critical incident reporting. Louisiana law, LARS, requires reporting of abuse or neglect. People who report in good faith are immune from liability. If you do want to read that law, that statute, you can do that. It's hyperlinked here. It's fairly short. Again, reporting abuse, neglect, exploitation, and extortion varies based on the age of the participant. So who you report it to changes depending on how old the participant is. If you're reporting for someone 0 to 17, that is a child, you report that to CPS. If you're reporting for an adult, that's someone aged 18 to 59, you report that to APS. If you're reporting for elderly, that's someone who's 60 or older, that goes to EPS. OCDD has a policy on customer complaints. You can file a complaint, a concern, or dissatisfaction with any services administered by OCDD. So that includes waiver services by contacting your LGE, that's your local governing entity, or calling this number here. And OCDD has a policy on customer complaints, which I believe should be right here. So if you bookmark this link, which we've talked about a few times, you can get that policy right here. You can see LDHs as well. Everything we've talked about, it is a lot of information. I understand that. But everything we've discussed is available to you at any time online. It's all in one place. This link here that we've talked about, and we visited this site a few times this afternoon, has all the information you would need. It covers critical incident categories. This is just a little of what the beginning of the page looks like. I wanted you guys to know that when you went to the link, if it looked like this, you're in the right place. What OCDD waivers are, critical incident categories. I mentioned if you go down, we'll get into this little section called SIMS and Operational Instruction F5. you guys are right here. You guys tell your SC about a critical incident. These are all the resources that you might need, all in this one link. So I highly recommend that you guys bookmark this link. Lastly, our acronyms. I try to say the acronym in its full name when I use the abbreviation, but the list is here. And so this is for y'all's reference. And I just want to thank you guys for your time. I know that it's a lot on your plate in the self-direction population. And I appreciate so many people coming. I think there are over 200 participants. This is my name. My name is Marilee Ashley Andrews. I'm a program manager here at OCDD in Baton Rouge at our central office. And you can see my email and my phone number is there. I'm going to go ahead and stop sharing. I'm going to look at the Q&A and the participants. I don't see any hands raised. So I'm going to go to the Q&A. I see that Christy has already answered some questions, so thank you so much for that. So my first question, are critical incidents reported just when they happen during waiver hours? No. Every critical incident should be reported anytime the participant has a waiver. So we talked about those rights and responsibilities. And when you are linked to an OCDD waiver, you receive that rights and responsibilities form. And so that is for all time while you are linked and certified to an HCBS waiver. So I'm going to type the answer there. That's mostly for my housekeeping in case I look at these Q&As later. So just bear with me. Okay, are planned doctor's appointments or planned procedures needed to be filled out a critical incident report? So for you guys, you're the self-direction population. All you're doing is you're telling your support coordinator. So my answer would be yes, you need to tell your support coordinator about planned doctor's appointments, planned procedures. For a broader understanding, a procedure makes me think it takes place in a hospital. And remember, any visit to a hospital is a critical incident. Whether it's planned or unplanned is not relevant. There was a visit to a hospital, that's a critical incident. The doctor's appointment, it depends in terms of a critical incident, it depends on where that appointment is. If it's in an office building, that's not a critical incident. But I believe that's something you should be discussing with your support coordinator regardless. So please tell your support coordinator all of the appointments, all of the procedures, and from there, your support coordinator will know to enter it as a critical incident when it needs to be. Where can we find the paper incident reporting form? Okay, so I'll share again. So on this page that we've talked about a couple times, if we open up this link, and remember, you'll see the beginning looks like this. You'll see a little bit about OCDD and critical incident categories. Keep going down. User resources. That's you guys are, these resources are for you as well as other people. Under forms, so it's going to be the last section under user resources, you'll see the OCDD critical incident report form. And I believe if you click it, it'll download up here. So you'll have to have your pop-ups enabled. It will download in a Word document. So this is the paper form. So the answer is on the critical incident reporting page. Okay, if you are out of town and need to see a doctor for a sinus infection, you go to an urgent care. Does this require a CCR? I don't know what a CCR is, but it does, yeah, it does require a critical incident. So remember, any visit, I'm just going to go back. Any incident or action that results in a visit to an acute care facility, an emergency room, or an urgent care center qualifies as a critical incident and must be reported. So what that question described was going to see someone for a sinus infection at an urgent care center. So pulling from that question, the pieces that matter for critical incident reporting is a participant went to an urgent care center. So that's a critical incident. Hey, Roxanne, does the report need to verbally shared with the SC, or do we need to complete a form and send to them? I believe you should be telling your support coordinator about this within 24 hours. I don't think you need to complete a form, but don't quote me on that, Roxanne, if you don't mind. Let me, please let me go look that up and get the exact information for you. While you're waiting on my answer, if a critical incident occurs, you can definitely do both and play it safe. Can you go back over traffic violation reporting? Yes, I can. Okay. Okay, so it's called involvement with law enforcement. A participant, their staff, or others responsible for the participant's care are involved in an alleged criminal manner, resulting in law enforcement becoming involved. Participant is arrested. Law enforcement is called due to the actions of the participant. Staff person is arrested. Staff person gets a traffic ticket. This is the slide on that information. And you can also go to the OIF5. And you can kind of go through all these categories and you can read it here more specifically, exactly like it's written in the OI. I think this is 1 for 1, but that's the information. Okay, I did not receive a clearance survey. I'm gonna have you email Pam, who is the person who spoke about that earlier. I'm putting her email in the chat and she can help you with that. Tony says, thank you very much. You're so welcome. Rodney, you're absolutely welcome. It's really my pleasure. Okay, we recently had a critical incident. I only reported it to our SC. I didn't know that we were supposed to also report to Morning Sun. I will tell you that was new information to me as well. That was the information I received from Waiver while I was making this presentation. So if you are in self-direction, they want you to report it to your support coordinator and your fiscal agent. A lot of thank yous. Y'all are so welcome. It's my pleasure. I want to make it as easy as possible for you guys. Someone's asking if I can send out a copy of the presentation. I'm really not sure. I'm a guest on this webinar, but I really love that I was able to get it online for you guys. Believe it or not, it was quite a project to get this webpage updated So if you bookmark this link, you can go down here under resources and you can get this at any point. So I hope that answers your question. I think it's important to kind of empower you guys to get the information you need so you don't have to go through someone or wait for someone to respond. This question, I'm not sure of the answer. Who is the best person to contact to share supportive resources? So I'm gonna tell you, Christy, can I tell her to reach out to you?
Yeah, that's fine, Marilee. And while you're typing that, I just want to clarify related to the critical incidents that get reported to the FEA. This is particularly important with hospital admissions and when they admit and when they discharge, because it impacts some of the payment, Marilee. So I think we'll provide additional clarification, but the FEA needs to be notified when somebody is in the hospital.
Okay, perfect. So I hope that answered your question, and that does make sense. Because you have to remember the self-direction population is just a little bit different. Is urgent care the same as a walk-in clinic? Yes, it is. Does the SC communicate the critical incident to Morning Sun, or is that the responsibility of the employer? So I think Christy just answered that question. What about unexpected or unplanned doctor appointments? For example, a cold. So remember, it doesn't matter. There was a focus on planned versus unplanned or expected versus unexpected. It really doesn't, that's not important. What's important in terms of critical incident reporting, I'm talking just about critical incident reporting, is where you went. So if the participant went to a hospital, an ER, or an urgent care center, that's a critical incident, whether it was planned or unplanned. Sometimes people make appointments at a walk-in clinic. It doesn't matter. If you went to one of those 3 places, it's a critical incident and it must be reported. Is there a different form for each incident? No, there's not a different form for each incident. Did I understand that we have to report critical to the physical agent as well as the support coordinator? So I think Chrissy just talked about that. I believe she said she would send out some kind of clarification on that. Can you increase the hours and how do you understand the hours? That is a question beyond my expertise.
Yeah, I was gonna jump in, Marilee, and say if you can just make a note, or if Carrie wants to reach out to OCDD-HCBS@la.gov, we can provide a separate response to that.
Perfect. I got that email in the chat coming your way, Carrie. Is a doctor visit or a follow-up considered a critical incident? So same answer. If you went to an acute care facility, an emergency room, or an urgent care center, it's a critical incident. If you went to a doctor's office, it is not. So I'll just give you an example. I try to stay away from examples because sometimes they can confuse things, but I just went to the walk-in clinic a couple months ago. It's free for me because of my health insurance. And the healthcare provider said, why don't you come back in a week for a follow-up instead of going to your doctor's office? That way you don't have to pay a copay. So again, is it a follow-up? Is it planned? Is it unplanned? Doesn't matter. It matters where you went. So if you went to a hospital, an emergency room, or an urgent care center, that's a critical incident. There are not different forms for each critical incident. Doctor's appointment for a regular checkup. Same thing. What it's for in terms of whether you report it or not is not relevant. I'm led to believe a regular checkup makes me think it's a doctor's office, so that's not a critical. If it's a hospital, an emergency room, or an urgent care center, it is a critical. This is a great question. If a participant was admitted into the hospital, are the SCs responsible to enter a CIR for each day they are in the hospital? The answer is no, they are not. So there's a date that the participant is admitted to the hospital, and there will be follow-up notes from the SC. So those follow-up activities that we talked about way at the beginning, on the participant's stay, and those will all be attached to the same CIR. And then the participant will eventually discharge from the hospital. So one hospital visit is one CIR. Okay, same question. A lot of questions about the fiscal agent. So I'm going to put that email that Christy mentioned. Review when to notify the fiscal agent. So I'm going to ask you to email ocdd-hcbs@la.gov. How do I get the forms to place in the home binder? So everything that we have discussed today is available on this link, which I will share again. Everything we've talked about today, pretty much everything. I can't think of anything that's not, but if we find that there's something not included, we can add it. But I'm quite confident everything we talked about today is available on this link right here.
Can you make that a little bit bigger?
Yes.
Thank you.
I'll put it in the, oh, I don't think it's going to let me while I'm sharing. Let me stop and then start again. Okay, so I cannot figure out how to enlarge it, despite that it is 2025. I haven't been on Zoom a while, but I did answer her with that link. And if someone can chat to the attendees, they could just put it in the main chat. I don't think I could do that as a panelist, but everything that you want is on this page right here. Everything we've talked about. And right here, it's gonna, when you first log on, you'll just see these blue bars. You expand this bottom one. This is where you can get the form, I think was the specific question. This is where you can get the presentation we went over today for the self-direction population. That's you guys. And these are all the policies that we've talked about. And this is the OIF5, which is kind of the one that stemmed this and all this whole presentation. The bulk of it came from there. Can you send handouts before the next meeting for note-taking purposes? That is also above my pay grade. I am a guest on y'all's meeting, which I'm so thankful to be included. I'll give you the email address that was mentioned earlier. And I think if you email them, they'll be able to answer your question more specifically. I'm not the host of this meeting. Okay, another question about the NCI survey. You can email Pam Sun. I just gave you her email in that chat. You're welcome. Someone said thank you. Okay, I understand that protective services are to ensure the safety of the participants. If the participant has a history of being aggressive towards caregivers, are we to complete a critical incident report, contact protective services as well? I'm gonna have you can just email me that question because I may want to get more information, but if I'm understanding you, APS is for abuse of an adult. So I think being aggressive towards a caregiver is more like an altercation. But if you can just email me more information, I can help you. Okay, another question about the fiscal agent. So I'm typing that
So-
HCBS. Oh, go ahead. Chris.
Yeah, so Marilee, I'm just gonna say again, so it's not all critical incidents that have to be reported to the fiscal intermediary, but hospitalizations, you do have to contact the fiscal intermediary and let them know that the person has been hospitalized.
Okay, so there you go. I don't know if that clears it up for anybody. Let me just make a little note. Yeah, and I think that was actually that was spelled out pretty specifically. So I'm just gonna copy and paste that. So it's not, as Christy said, if I'm understanding it correctly, it's not every critical incident, emergency room, urgent care, or acute care facility visit. So those three, thank you, Christy, that's helpful. A lot of thank yous, you guys are so welcome. Okay, this is another one. How do we report the incident to Acumen? Do we email them or is there a form?
I believe that they would need to, we'll provide clarification, Marilee, but I believe there's an agent that is assigned to each person in self-direction, and that's who they would contact at Acumen or Morning Sun to just notify them of a hospital.
Okay, perfect. I'll put that in there. Please give link to critical incident reporting. I am getting error 404. Okay, I will send you that link right now. And I'm going to show you guys something as well. Sometimes if I don't want to go to my bookmarks, I will just Google OCD Sims. And if you Google that, it's going to be generally the first one. And this is the link right here. And I'll put that in the chat. I understand that protective services are to, oh, I'm sorry. I think I answered this one already. Okay. Geneva says thank you with a very cute emoji. You are welcome. It's really my pleasure. I want to be as helpful as possible to you guys. Okay, I'm seeing some duplicates. So I'm just going to type answer live. What if your support coordinator doesn't report the critical incident? What if you can't get in contact with Acumen to report the critical incident to them? How can you know or be sure if these entities are reporting what you report to them? That is a great question. I guess I've never had that. If you email me directly, we can talk more about that. Support coordinators have certain roles and responsibilities, which we discussed. And so they're trained to make a monthly contact and to report critical incidents that occur. I also think you should be able to get into contact with your fiscal agent. Christy mentioned earlier, kind of a mechanism for that. So I'll just put in both of my email and the HCBS email, and you can email your question there, and we can get more information and make sure that we answer you directly. I'm just scrolling through you guys. 1 second. Okay, if staff is not on the clock, the participant is sick and needs medical care, is it necessary to contact the support coordinator even if staff is not present the entire time? I'm going to ask you to email the HCBS email on that one as well. Questions about time and things like that, they're really better to answer. So I'll give you that email and they'll help you out, or I'll work together with them if they need me to. Do planned weekly physical therapy sessions meet the requirements for critical incident? So it depends on where the physical therapy is. I think if it's at an office, which is usually in my mind where physical therapy is, but I don't want to make any presumptions. That would be not a critical incident because it's not an emergency room, urgent care, or acute care facility. So I'll just give you that guidance in there, and you can email me if you need more information after that. Karen, self-direction employers should definitely report a critical incident via email, so they have proof that they sent it to the support coordinator. Do not rely on just a phone call. Okay, so that was some guidance. Understand when to notify the FEA. Oh, I'm sorry. I understand when to notify the FEA, but I asked how to make the notifications. So I think Christy answered that earlier. Let me go.
So I'll say this, Marilee. I don't know, Janet, if there's a specific form. I'll have to follow up with Acumen and Morning Sun. I would follow sort of what Karen shared, that I would email it or contact Acumen or Morning Sun, whomever you're with, and report it. But we'll follow up and we'll see if there's a specific form that has to be filled out. I do know when you notify them, you want to know the date of admit. And if they've discharged. So we'll get more specifics about if there's a particular form and get that back.
All right, thank you for the information. You're welcome, Caitlin. I hope it was helpful. Once you report to a support coordinator, they will have to follow up with you regarding this matter, and you should receive a summary once the report has been closed. So I recommend following up with them. That's a great suggestion, Sonia or Sonia. I'm not sure how to pronounce it. And she is correct. So that's part of the support coordinator's responsibilities in a critical incident life cycle. When it is finally closed, they send you an incident summary, essentially. So thank you for that. I did not even think to mention that. When staff is on the clock, when the client is taken to a hospital for a critical incident, does the staff stay only until the client is admitted and then clocks out? We had a question about that. And I think it's like has to do with billing. Chrissy, do you want to answer that, or do you want me to take a shot? I just don't want to mix the words because I think it was a pretty specific answer.
Go ahead. You can go ahead.
Okay, so as I understand it, you can't, like, Medicaid can't bill for two services. So I believe when they're admitted, then the worker would clock out. Is that y'all's understanding, Janae and Christy and maybe Kim?
Kim, do you want to talk through that a little bit?
Sure. Yes, when someone is actually, so you go to the emergency room, they're being treated, the doctor comes back in and says, we're going to admit this person into the hospital. That time of admission is when paid supports have to stop. What happens is that hospital bills for that service, and when OCDD or when Acumen or Morning Sun tries to bill for a service for that person on the same day, it gets denied. So our billing system will not let both go in at the same time. So once they're admitted, check with the desk and say, what is their time of admission? And that is when you stop services, paid services with the DSW.
Okay,
Uh,
perfect.
Okay.
Thank you, Kim. How about ER visits out of state? Please still report them to your SC. That's very important. Yes. Thank you so much. You're welcome. It was a lot of thank yous. You guys are welcome. It was very fun for me. I hope I made it a little bit interesting for you guys and it wasn't too monotonous. There is some heavy information in there, like I mentioned.
Marilee,
Yeah.
we did receive an email. I do want to check one thing. If someone goes to a doctor's appointment for pneumonia, does that require, because they go to the doctor says you've got pneumonia. I guess what would typically happen is they would end up in a hospital. But if they didn't, would a critical incident report be required for that, for a hospital, bowel obstruction, things? Are there things that if they go just to the doctor's office, they would still have to report a CIR?
Oh, I see what you're saying. Like if you go to the doctor's office for like one of the 4 things in that bullet, is that what you're?
Yes, yes.
Okay, yeah, still tell your SC that information and it kind of depends, but just tell your SC. Like not every seizure is reportable because there's seizure, protocols in the plan of care and things like that.
So any doctor visit, they should report to their support coordinator and the reason for the doctor's visit.
Yeah, I think they do that regardless. It's not a visit to an office is not a critical incident. A visit to one of those 3 places is, but I believe that's something they talk to their support coordinators about regardless. And that's really important. That's kind of one of the roles of the support coordinator is determining they can help find if it's a critical incident and what category it goes in and things like that.
Okay. So if you're not sure when you talk to your support coordinator,
Yeah.
they should be able to flesh that out.
Yes, and they may
Okay.
not even mention like the word critical incident or SIMS, but they should be entering it if they determine it is. Okay, ooh, one more. Oh, Diane, you're welcome. Shout out to Christy and Kim. All right, I don't
All right.
see any more questions. Yep, Christy, take it away.
No, I was gonna say thank you so much, Marilee. We really, really appreciate your time and coming to speak with us. Oh, it looks like we got one more question, Marilee.
Okay,
2
let
more.
me go look.
I'm gonna turn it back.
Okay, our family member is bedridden, has to be transported via ambulance. Anytime she goes to visit a doctor. I've never gotten that. Consuelo, you had some excellent questions. I have never had that question. If you can email me, I'll give you my email. I will research that. An ambulance ride is not a critical incident. I just need more information, so I'll give you my email on that one. Do you complete a CIR when a participant visits their physician's office, but bill under the hospital they are located in as outpatient services? Okay, wait, I see another one. Do you complete a CIR when a participant visits their physician's office? I don't, I'm gonna ask you to email me as well, Marla, if you don't mind. Oh, hey, Marla. And we can talk about that because I think you're asking like kind of more about the Medicaid billing bump project, which has nothing to do with like the self-direction population. I don't think needs to hear about that. Bené Brown, you're welcome. Lisa wants to email me. That is totally fine. I will type it. So again, you can go here and you can open up this slide deck. And I am on the last slide right here. This is my email. You can click it and it will email me directly. Okay, a couple more. Okay, good deal, Marla. Scheduled medical transportation is not a CIR to doctor appointments. The way the doctor bills does not interfere with Medicaid billing. Okay. Will the presentation be available later? Cheryl. So I will show you this quickly. If you go to this link, and I'll send it to you in the chat, you can scroll down. The beginning of this page is going to look like this, okay? And you just scroll down, and you'll see these blue bars, and they all expand. So if you click that resources one, you can get the presentation right here yourself. And my email is on there. A lot of things we talked about are linked right here for you. So that is something you are enabled to go get yourself. I think it's important to make the information as accessible as possible. It's all on one page. We went to a lot of effort to get it all on one page for you guys. So you can get that presentation right now and at any time in the future. Okay, Lisa, if a client has been arrested and had to go to the hospital, do we need to complete another report for the hospital trip? So this is, okay, Lisa, so if you're a self-direction participant, you will tell your SC that the participant was arrested on this date and they were admitted to the hospital on this date. And it depends on the dates of if it will be one or two critical incidents. So I don't want to like muddy the water and over explain it. But if you report both to your SC, they will enter the CIR correctly. Remember, in the self-direction population, you guys don't have to worry about some kind of in the weed details like reporting housekeeping things. You just have to get that information to your SC. Did I miss the acronym? I don't know which acronym you're referring to specifically, but there are a lot of acronyms, as always are. And I put them all in this last slide for you guys here. So these are all the acronyms available on this slide deck that we went over today, which is available here on the OCDD SIMS page.
And Marilee, can you leave your email address up so they can copy it down on your slide deck?
Absolutely, yes.
Okay.
Is that big enough?
It is.
Okay, perfect. Yep, that's my name and my email and my phone number. Okay, I think Monique got her question answered. Sarah says, thank you, you're welcome. Okay, Sydney, we are admitted into the hospital every 2 weeks at this time for injections. Yes, if you are admitted to a hospital, that is a critical incident. So a lot of questions about, is this hospital a CIR? Is this one? Is that one? All of those are kind of answered in this one little paragraph that we talked about in the slide deck and I'm putting it in the chat now. Just if you have a question like that, you can just think of it this way. Any incident or action that results in a visit to an acute care facility, we know that's a hospital. An emergency room, we know that's an ER or an urgent care center, qualifies as a critical incident and must be reported. I don't see any other questions. If you think of something after, you're more than welcome to email me. I will get back with everybody as quickly as possible. It may not be incredibly quick, but it will be as quickly as I'm able to because I am only one person. You're welcome, Chandrika. I recognize your name. Good to see you. Okay, I think that's it. I'm gonna mute myself.
Thank you so much, Marilee, for the information and for presenting for us today with this group. We appreciate all of you being able to attend and listen and take in all the information. Just sort of as a follow-up, we'll look to get notification out in the next month or so for our next quarterly meeting with topics and agenda. Please reach out if you've got questions for Marilee or there's something that the waiver team can assist with. We're happy to do so. Thank you all again for your time, and thanks, Brenton, and to the DD Council for helping us get the information out.